Today's training is going to be for the providers and medical assistants, how to further engage the medical oversight and instructions to other staff members, in particular by looking at patient notes and charts and preparing for patients, but as well relaying information and notes to the physical medicine assistants that are actually performing the therapy on the patients. A good rule of thumb is to start your day with looking at your schedule as seen here, preparing, of course, who you're going to see for your initial exams, your trigger points, but taking a step further by getting engaged with the patients that are coming in to see the therapist. Now, you're going to be noticing that some of these patients have active trigger points, are still in pain, and they may show good signs of improvement, but our goal, as always, is to get maximum medical improvement in the shortest amount of time. And one of the ways that we do that is, of course, trigger point injections, prescribing of topical medications, and getting more involved in advancing their care. Now, one way to do this is by looking at the notes from the past treatments. For example, we can look into this patient here by double-clicking. And, of course, will come up the appointment history. So you can see how they've been doing, where they're at on care, they had a consult for injection, what the results of that was. But also, looking at the appointment notes gives you a clear understanding of what the therapists have been finding during their hands-on treatment. Here, for example, you go in, click on the note, and go into the objective. Subjective tells you how they've been feeling. 4, feeling a little better, 60% of the time, and in the areas. And objectively, what they found. Now, this patient has a ton of hypertonicity, restrictions, in several trigger points. Now, that's something to be noted because if they're not improving, say they're getting better, but they're still having pain in all these trigger points, what can we do to advance their care? And one of the ways is to get the therapist involved, to have them come down and do a trigger point consultation if they haven't already done one in the past. Now, this patient has, but I'll show you an example of how to send a message to a therapist. They will be checking their messages throughout the day, but how to identify and flag certain patients that qualify for trigger point, or at least a consultation. Now, this patient, Mike, you'll go to your home or to messages. You'll do a new message, not a new portal, but a new message. And today's therapist was Summer. I remember that from the front screen. I'll send Summer a message here. Now, Sydney is already on here, so I'm going to take that off and just do one for Summer. Now, I'm going to put review as soon as possible, or maybe respond. I want to know what's going on, a referral, different things. Review. Priority I'm going to set as high, and I'm going to search for the patient by last name, and there he comes up. Sometimes you might have to go through these. His was pretty unique last name. And I'll put in the message, have patient schedule trigger point consultation, has several trigger points noted in his charts, or his chart notes. What you would do from there is then save it, and it will send automatically. The therapist should get notification on their iPad and notify them that they have a message, open the message, and ideally see it before the patient comes in, discuss it with the patient. If the patient has time today, go down and see the provider for a consultation. Doesn't necessarily guarantee they're going to, but it's a way to get involved and progress the patient's care and also show that you are getting involved in their care. And therapists appreciate that, and I'm sure the patients do too. To get more involved also, you can identify certain patients that haven't been progressing. You can look at past trigger point history and really get an idea as we become less and less of a paper and chart office, getting more paperless by looking at notes and preparing for your day. You can see past trigger point procedures, how well they did, how many cc's you used, and so on. That'll conclude today's training. Look forward to training with you more.